oftentimes moms are just so happy the baby's on that they don't want to break the latch and start again because like, we finally got the baby on, let's just leave the baby. But if you're in pain, it's not going to work for you, as well as if the latch isn't correct, the baby's probably not getting the most effective milk transfer that they could.
I could tell that when I was comfortable, he was comfortable. When I was tense and uneasy, there was no way he was eating comfortably.
There are several different positions with breastfeeding. Basically, the right one is what works for you. So try them all out, see what works for you and what gives you a comfortable latch. The first one is the cradle hold. I usually don't recommend it for a brand newborn because they don't have the head control to be able to maintain or find that latch on their own. Usually it's like, oh, wait, their poor little heads are all wobbly. And if you think about it, if you hold in the cradle hold, their nose is now lined up towards your armpit. I know I don't have a nipple in my armpit, so you kind of want to make sure the baby's over here, okay, which is usually not very comfortable for you. So if you do a cross cradle hold, where you take their bottom, put it in the crook of your arm up the spine, and hold at the base of the neck. They need to be able to tilt their head back to get a nice wide mouth. So if you hold their head back, you can't do that. So just support their neck and at the base of their neck and their upper shoulders, okay? Line their nose up with the nipple and then tickle their nose or upper lip. They're going to tilt their head way back to open their mouth and then just give them a gentle tug in. And it should land the nipple in the comfort zone of your mouth. The comfort zone in your mouth, if you run your tongue over the roof of your mouth, you feel the hard palate in the front and you get all the way up to the top. That's the soft palate. That's the comfort zone. Your nipple stretches about 2.5 times the size to reach to that nice comfort zone, but it doesn't hurt if it reaches that spot. So if it pinches or it hurts, you know you have a shallow latch where the baby's not getting enough of the breast tissue in the mouth and it's causing it to pinch. So simply break the latch by sticking your finger in the corner of the mouth until you feel their gum line, drop their jaw, their lower jaw, to release that latch. Because if you just slide them off, that's going to cause friction on your nipple and cause pain or breakdown. Other positions are the football hold. It's a great position if you've had a C-section because there's less pressure than being held on your belly. So just simply, same position, tush in the crook of your arm up the spine, and hold at the base of the neck. Slide them down to your breast, but you're going to hold it kind of on your hip. Okay, make sure you use pillows and blankets to roll up so you're holding the baby at the height of your breast. You always want to make sure you're supported when you're breastfeeding because breastfeeding can last for a longer period of time.
This is a breastfeeding pillow. It's the best thing ever. It helps you to raise your baby a little bit higher so you don't have to bend over and hunch your back.
Baby stores sell specialty breastfeeding pillows. However, it's not necessary to have one. Simply rolling a blanket up or using a pillow can help support your arm. Typically, there is no time limit with the baby on the breast. There's very old school thoughts of giving the baby 10 minutes or 15 minutes on each breast. If you think about it logically, if I told you you had 15 minutes to eat, I came up to you at 15 minutes and I took your plate of food away and you were still hungry, you'd be kind of upset and hungry. Okay, if I told you you had to eat for 15 minutes, but at 10 minutes you were full, you kind of feel uncomfortable because you're trying to force feed yourself and you can't do it. So if you follow your baby's cues, you let them stay on the breast as long as they're actively sucking, they fall asleep or they self-detach, or if they're a sleepy baby, you can't stimulate them to go anymore, then you know they're kind of done on that side. You break the latch, sit them up, burp them, wake them up again if you need to, and then put them on the other breast and let them go again. As long as they're actively sucking, they fall asleep or self-detach. If they're still hungry when they come off that second breast, you can offer them a third or a fourth breast. You can switch it, it's okay. Breast milk is produced by supply and demand. Okay, so you need to let your baby do the demanding they need to make the amount of milk they need. And your body will produce it.
In the first couple of weeks of breastfeeding my first, I had a lot of pain. At some points I thought I might have an infection and I didn't. It was just, it was just pain. It was just painful to start with.
Breastfeeding is not supposed to hurt. Pumping is not supposed to hurt. If it does, if it pinches, if it's just even uncomfortable, you should ask for help.
I did call the La Leche League. I called them I think twice a week in the beginning, and they gave me a lot of helpful tips and pointers on how for my milk to come in, how to relax, how to drink something while you're breastfeeding. I would have never known that.
I was determined to also breastfeed my twins at the same time, just because I wanted them on the same schedule. So getting them to latch on at the same time was a bit of a challenge, and then it became painful, and then I thought I was doing something wrong. It's really just a process that you have to continue to work through.
It's never too late to get help, but the sooner you get help, the sooner things are going to start getting better for you.